Hi everyone, today I will be walking you through the grass frog dissection. So we are dissecting grass frogs. A lot of other dissections will be done with bullfrogs. Their anatomy is going to be extremely similar. Bullfrogs are just a little bit larger. These just come to me labeled as grass frogs. However, it's likely that they are northern leopard frogs. But we can't say for sure. So before we start the actual dissection, we'll go through some of the external anatomy. Just going to zoom into the head region. So here we can see the nares right there. Obviously the eye, and the frogs will have a nictitating membrane, so kind of a third eyelid there that they can see through. Then we have this circular piece here, which is the tympanum. So this is going to be essentially equivalent to an eardrum, and that's going to be what's helping them to hear. Communication is very important with frogs, especially in terms of mating. They've got important calls with that, so very important that they have a highly evolved auditory system. I'll pan back out a little bit and take a look at the mouth. So if we were to turn our frog right over here, you can see the line of the mouth there. And if we actually open the line of the mouth, the tongue will already start to come out. It's got a really cool musculature here, and I'm actually just going to make two little cuts, one on each side of the mouth, so that we can see inside the mouth a little better. There we go. Now we can look inside here. We can see all the way to the back of the tongue. And if we turn it to the side here, you can see that the connection of the tongue is actually, let's just see. We turn them here, you can see the tongue is actually connected to the mouth quite far forward. And that's going to be what allows the tongue to move forward when capturing the prey. We can also look at the roof of the mouth. So I'm just going to hold the bottom jaw down, and we'll focus in on the upper portion of the mouth here. So if I run my probe along here, I can feel some just tiny ridges, and those are going to be the maxillary teeth. So maxilla is just the word for the jaw. So these are the teeth that run along the edge of the jaw. And then right inside here we have two little bumps. Not sure if you can, here, let's get the angle a little bit better. So we've got our two little bumps right here, and those are going to be the vomerine teeth, which have more of a role in helping to capture prey. We can also see the internal opening to the nares. So if you were to use a thin enough probe, you could actually go all the way through to the outer surface at that point, but there's really no need for us to do that. Just before we move to the internal anatomy, there is one feature that we can often use to help us to be able to tell whether we are looking at a male or a female frog, and that is their thumb. The males will often have a funny little structure that's a little bit inflated. So I have an example on a different frog here. On our darker colored frog here, we can see this large bump on the thumb, and that is absent on this lighter colored frog. So there's its little thumb there. We're not seeing that big inflation. So I believe that this one is going to be a female. So now that we have looked at the external anatomy, we can take a look at the internal anatomy. So for this one, it is important to note that the skin and musculature are both quite thin. So I'll be making quite shallow cuts. And essentially I'm going to be going from the region between the two thighs and taking it all the way up to the pectoral region, and then I'll be doing a couple of horizontal cuts so that we can open up the abdominal tissue. And again, being careful to not go too deep, and just like we've done on some of the other dissections, it's always okay to switch over to scissors if that's something that gives you a little more control. Now I am just going to grab my scissors to make sure that I've gone deep enough. And I did go slightly deep on one section, but should be just fine. Now we can pull our abdominal tissue off to the side. We just have to coax it a little bit more. There we are. Got one side open. And the other side here. And I'm just going to complete these cuts and get them pinned into place. Okay, so we do have the abdominal cavity cut open, but we do need to go just a little bit higher so that we can also view the heart. There is a little hard plate there, and once you've cut through that, you should be able to move that off to the side. Okay, so now we can take a look at what we have going on inside here. So right now we have a very large mass here, and this is the frog's liver. This one is taking up more space than I'm used to it seeing. Not sure if it's truly that the liver is enlarged or if it's just an artifact of how it was preserved. Sometimes that does happen. In either case, I'm just going to remove this so that we can actually take a view of some of the other structures. What you should be able to see fairly clearly, even while I've still got some of the liver intact here, is we have a little kind of a hollow looking sac, and that is the frog's gallbladder. So of course the liver, or the gallbladder, is storing the bile that's produced in the liver, so it makes sense that it would be found right in the lobes of the liver there. Just going to tidy this up and then we'll go through it kind of piece by piece. So if we start at the most anterior portion of the frog, so closest to the head, the first internal organ that we'll notice here is the frog's heart. Now you can see that there is a thin membrane overlying it right now. That thin membrane is the pericardium. And we can just remove that to get it out of the way. Now frogs will have a 3-chambered heart. Sometimes it can be difficult to actually see the atria because they tend to be quite anterior and are often covered. However, if you want to go a little bit higher up, you should be able to see, you might not be able to see it on the video, but we have our right and left atrium and our ventricle. If we move the heart kind of anteriorly and move any of the residue of the liver out of the way, I'm just going to put a pin in the heart so that it's not getting in the way of the digestive system here. Actually, before we move on to the digestive system, I'll also point out that on either side of the heart here, we can see the lungs. And if you're not sure if it is the lungs, you can just use your probe and press it. It should be extremely spongy if you are in fact looking at the lungs. Then, so we've moved the heart anteriorly, and underneath here is where we can see the frog's esophagus. And from the esophagus, we can move down into the long stomach. So that whole structure there is the stomach, and that'll go all the way to this little narrowing right here, which is the pylorus. Now the pylorus, of course, is the junction mark between the stomach and the first portion of the small intestine, which is the duodenum. So this, we've got a little bit of a kink in here. Looks like we actually have an insect part that was causing a little bit of trouble in there. So this first portion here is the duodenum. And in between the duodenum and the stomach is where we'll find the pancreas. Now in this frog, the tissue of the pancreas is not looking really distinct. However, that region between the stomach and the duodenum is where we have our pancreas. If we lift our stomach and move it to the side, we should be able to find a really round structure. It's hiding out right there. And that is our spleen. So we'll just move this a little bit. There we go. Just move that. There is the spleen. If we continue from the duodenum, we can continue to look at the rest of the small intestine. So the next portion of the small intestine will be the jejunum. And in amongst the jejunum, you should be able to find the mesentery. So this sometimes involves a bit of uncoiling to be able to see the mesentery. So So there we can see that there's a membrane here that kind of connects the pieces of the intestine together. Difficult to see because this frog is not dye injected, but there are also veins and arteries throughout the mesentery. The mesentery used to just be thought of as kind of a connective membrane, but in the last kind of 5 years it's been identified that it is in fact an organ. From the jejunum we get to the ileum, which is the portion of the small intestine that's closest to the large intestine. Difficult to tell the difference between the two sometimes. So really we're going to proximity of the other organs. And this really thick one here is the large intestine. This one is quite full, which is why it is so wide. The wastes would exit once they've passed the large intestine. Can sometimes be difficult to find, but also down in this area, we'll be able to find a folded, stretchy piece of tissue. And that's what I've got in my forceps right there. And that is the urinary bladder. So it's very thin and stretchy. Some frogs actually use this as a defense mechanism. So if they're caught by a predator or a human just trying to get a better look at them, they will often pee as a defensive mechanism. Now you've probably noticed a lot of kind of orange bits sticking out. So we've seen that a lot of them over on this side here. Got them on the other side as well. And these are what are called the fat bodies. These are extremely large fat bodies in this frog here. So that tells us that this frog would have been close to ready to enter into hibernation. That's why we're seeing all those fat bodies. Now often what else we can find near the fat bodies will be the reproductive organs. So because this frog has so many fat bodies and is ready for hibernating, it actually has very small reproductive organs. So this area in here is the ovaries, but we're not seeing it filled with eggs right now. The eggs are just really quite tiny. If we move the fat bodies off to the side here, you can see a little bit further down in here. Just actually going to use a paper towel to get rid of some of the moisture. Okay, so now that we've moved the fat bodies and the ovaries to the side, we can still see the ovaries a bit here. We can see these structures here that look a little bit like the dehydrated ramen noodles. Those are actually the oviduct. And then alongside the oviduct, we can see a long dark section. Not sure if you can get as good of a view as I have, but I can see a couple lobes there. And that is the frog's kidneys. Of course, if we move this over to the other side, we'll again see this kind of mirrored structure. So we've got the fat bodies. We move the fat bodies aside. We can see some ovaries and oviduct. And this one, it's just a little more difficult to see the kidneys from this view. They are tucked down in there. But that's kind of a good tip, is that if you're having trouble finding any of the structures that we're wanting you to identify, feel free to take a look on the other side, because often one side will be easier to view than the other. Here we're looking at a second female frog. And in this case, you can see that most of the abdominal cavity is full of these dark colored eggs. In fact, one side of the egg is a darker color, one side is a lighter color, pertaining to the animal and vegetal poles. In a frog with this many eggs visible in the abdominal cavity, of course they're not just free in the abdominal cavity, they are in the ovaries. Some of them even a little further down in the female reproductive tract. We will have some fat bodies. They just may be very difficult to access, to be able to view them, and they will be quite small and fairly depleted. Now, unfortunately, the male frog that I have on hand here doesn't look exceptional in his internal anatomy. Basically, some of the frogs just do not get very well preserved and they end up with a really poor texture inside. What we can see here, though, is that we do have, again, some fat bodies. And then right here, we have this kind of bean-shaped organ, and that's going to be the frog's testes. Sometimes you will also be able to view a vestigial oviduct in the male frogs, especially if they're a little bit younger. And sometimes you will be able to view the vas deferens. However, in this one, the preserving technique doesn't allow us to see either of them. So there is your quick overview of the internal anatomy of the frog.